Welcome to the lecture dedicated to the alveolar bone reconstruction in implant dentistry. What we are going to talk in the next hours is a modern concept and a modern approach to promote bone regeneration in daily practice. It's obvious that when we are looking to these defects in the front maxilla or in the posterior mandible, as well in the posterior maxilla, it's obvious that the main question is not correlated to the diagnosis phase, but is related to the fact of the predictability, how we can achieve the goal of the treatment. And an important moment in the treatment of this kind of defects is to define the right goal, what I'm going to build up. And this reconstruction, how is going to impact to implant placement and to implant osseointegration. Because we need to have always in mind that complications rate in relation to bone reconstruction surgery is quite high. We have almost the 13% of complications rate for horizontal defect management, and we have a big range of complication varying from 0 to 45% when we are talking about vertical bone augmentation, as reported in a review published by Rocchietta and co-authors in 2008 in Journal of Clinical Periodontology. And 1 year later, the ITI group published a review of the literature bringing data about complications rate associated to vertical bone grafting, also quite high. We have vertical complication with vertical bone block augmentation that is almost 30% of the cases, and with particulated material a little bit more than 20% of the cases. It means that we have really a problem clinically that has to be solved, not just from a diagnostic point of view, but from a clinical point of view, how we can manage these kind of defects, bringing predictability into the treatment. In a very recent publication, 2016, we can see still this number very high. We have 25% of complication after stage horizontal ridge augmentation and 80% after stage vertical ridge augmentation. And that brings a real problem in the daily practice, because we need additional augmentation in many of these cases. 37% after stage horizontal augmentation and 9% after stage vertical ridge augmentation. It means more therapy, it means more cost for the office, for the dentist, and for the patient. Why? Because basically when we have a complication, we have a loss in the bone volume in case, and this complication is independent basically from the technique we can use, because we can have problem with no resorbable membrane, for example, like in this case where we have a partial loss of the graft, not everything, but anyway we start or we finalize the case with an implant that is not in optimal condition from bone point of view, so we could have problem during the follow-up of this implant due to the fact that we have a surface of the